we're not going to be able to, in good faith, keep people here through the winter and have a 12-hour notice because we know that the storm's coming in and is expected to drop an inch an hour for 6 hours upstream. So temporary, we have to move it for that reason, and we need locations to move people to. And so we could walk down and all of the people who
yeah, let me talk a little bit about this. You know, the city and the county before was more of a funder of the managed encampment model. The city started it originally with a profoundly successful program at 1220 River Street. We then morphed that into a provider-based program. Salvation Army was operating that program through HEAP funding. So that's really our community funding via the state. That was then morphed up to the Armory, and thank you for our state partners for helping us get the Armory. This program now, yes, Stone, absolutely. Someone in Stone helped that happen, and we actually now have the Armory through the years, so that's really made a difference in the amount of capacity we're able to provide. And making it 24/7, that's been a big, big change in how we do shelter in our community. This program, I think, well, we have Adam here, our manager, Adam Carruthers, and Jeremy, assistant manager. We've been in operation 2.5 months of that. I think we opened the end of July.
Between 2.5 and 3.
Yeah, and so I'll let Adam and Jeremy talk a little bit about it. I want to say what's really important about this. This program, as Chief HAJDUK said, we have a problem with a winter placement. It's also a funding issue. We can't get FEMA reimbursement for this program. It's in a floodplain after we hit winter. So that's the other reason. It's not just we got to move it, it's that if we can fund it, we have to move it. We're also using, the county has allotted a portion of our Corona Relief Act funds to fund this program. So that's how we're putting it together. This and all of the 13 coronavirus-related shelters we've done are now actually an employment program here. We have over 250 extra health disaster service workers we have employed to operate this system. The county operates it. It's too large for us to rely or ask any of our community providers to do that. With that, Adam, do you want to say anything about how it's going? What's different about this program, the services we offer?
Yeah, sure. Hi, everyone. So, I mean, anyone who's kind of seen some of the encampments around this area and anyone who's taken a little time to check out our kind of version of that encampment, you know, there's a big increase in spacing, which is great for right now, you know, because the whole pandemic deal. There's also a really big increase in safety. We've had, I think, maybe 3 safety-related incidents, kind of altercations, in the whole time we've been opening. When I was down here kind of doing consultation before the camp started, I witnessed probably 2 to 3 physical altercations every day. So yeah, I mean, just generally a big increase in like health standards and safety, and most people down there are awful happy about it. And most people down there are awful hoping that, you know, they'll be able to get a new space to go to.
So Adam, we provide 2 or 3 meals a day.
Oh, yeah.
So can you talk about some of the basics that we offer?
Yeah, so I mean, you know, everyone gets their own tent and a sunshade, which is great because especially earlier in the year it was blazing hot. We do 3 meals a day. We have a laundry service that we work with. We are kind of hooked up with county benefits over at Emmeline. We have a worker that we collaborate with over there to get people their county benefits. We're working with Downtown Streets team. They visit at least once a week, sometimes twice a week, for recruitment, which is employment, and also case management with their people that they have recruited. We work with HPHP. They visit twice a week to provide health care measures for some of our campers. Jeremy, am I missing anyone?
No, that's pretty good.
Can you guys talk a little bit about these kinds of protocols? I mean, we can't force people to wear them, but what's the practice within the camp?
Oh, so I mean, the most important is like well, obviously, so when someone's in their tent, you know, that's basically their house. So, you know, you're not going to make someone wear their mask in their house. That's ridiculous. But we just have it so people wear their masks whenever they're up front, especially around the food area. We hand out all the food, we serve the coffee, that kind of thing, to kind of keep touch points down. We also do very frequent, I think it's 5 or 6 times a day, we sanitize high contact points. Yeah, just masks, upon entry in the main areas where, space is shared. And then, people are welcome to take their masks off when they're residing inside of their own tent space. And then all the tents are spaced a little bit more than 6 feet apart, just for,
So Lisa and Jeremy have offered to give whoever's interested a tour of the
If anyone wants to walk through, if we don't have time, we just wanted to make that available if people wanted to walk through.
So I think, just to respect everyone's time right now, we're going to let the department heads share some of the impacts their department's facing with regards to Benchlands, and then we'll do a quick debrief, and whoever wants to stay and do a quick tour of the Benchlands will do that. Chief Bill, Tony, Mark, is there anything you guys wanted to share regarding Benchlands?
Regarding the Benchlands, I just really want to applaud the county because this has worked so well. And one of the things we see is anytime the camp is managed, it becomes a much better proposition than an unmanaged camp. And it becomes workable, and you're right, the calls for service have decreased, anecdotally at least, because of your management of the Benchlands. And as most people here know, the majority of our calls for service during the daytime especially are people either in mental health crisis, who are oftentimes homeless, or drug addicts, or people with substance abuse problems, or people who are passed out and in fights and that kind of thing. So this is very helpful, and I thank you for all the work that you guys have put into it and your staff.
I would just say that I agree with you, Chief. We'd like to see a larger area actually, because we have, as you go along the levee, you see people that are camping, but they're not in your managed camps. And then we have those other issues where it's an unmanaged situation. So this is great. We'd like to see it have a larger or another one where you can handle it.
And I know it's hot out here, and it's been a long day, so...
Yeah, I just wanted to add too, I think as everybody's noted, having a managed encampment is a beneficial thing. And as was also noted by our fire chief, is this needs to move. And so we have to work with the county and doing. However, one of the challenges I think for the city, and that we hear concerns from our community members, is that the city has a high concentration of facilities already, whether it's Coral Street, whether it's the Armory, whether it's Emmeline. We host a lot of facilities already, and the honest truth is that we hear concerns from our community about locating additional facilities, and they'd like to see the facilities be further expanded in our county, and not just simply within the city of Santa Cruz. So that is an issue that we're also facing and having to confront. The concentration of services and facilities in our city is, I know, a large political and community issue that we have to deal with as well. I want to be clear about that.
And I think we'll just wrap up the day with some closing remarks from our mayor, vice mayor, and Martine, if there's anything else you want to add. And, give everyone an opportunity to kind of just ask questions or discuss what you saw today a little bit more. We have the managers of Benchlands here, and we have department heads, Martine, and our mayor and vice mayor to answer any questions you guys might have. So,
First, I just want to thank everybody for showing up today and for being available, because I think that we're at a point where we really want to try to do as best we can to work together at all levels, from city to state, the federal partners, to figure out what we can do and be effective. I remember, and I'll just tell a quick story of how last year when we had the Ross camp, we had an unmanaged encampment that, yes, while it provided shelter for some folks, we were constantly receiving phone calls from residents regarding increased theft, drug use. There was a lot of concerns about how that camp was run, lack of spacing and the potential for fire and loss of life. There was also wound botulism. There was an outbreak of that there, so the public health threats. And so, that was a situation where, although people were able to provide and find shelter, it was not a humane thing for us to do, and we knew that we could do better. And we've been able to work with the county to set up these more effective managed encampments where we as city council members, we're not getting calls about issues with Benchlands encampments. We get very few emails regarding this having a negative impact on the surrounding communities. We haven't been getting calls about the safe car camping sites that we have throughout the city, one of which is right down the street from my house, and it's never been an issue. We don't get calls about the armory. So what I think we've been able to demonstrate over the past year with with COVID and then having to have more and receiving more funding to provide these services is that when the funding's available and we can hire the staff to help manage these encampments, it's big work. And they're compatible with our community. And I think that to the extent that we can see more of these services provided throughout our county, we'll be able to provide shelter that has less of an impact. But more importantly, as we were mentioning earlier, in addition to having these forms of shelter, we really need the wraparound services and getting people into permanent supportive housing. Because while we have, what I'd like to point out is the sanctioned kind of space is what's behind these fences. And we have, people overflowing in these areas. We have what we saw earlier with people overflowing into some of the other open spaces. And what we really need is to be able to bring people into these managed programs and then move them on to permanent supportive housing so that we can have a pipeline for people to get stable, get shelter, and then move on to housing. And so with that, I'll pass it over to Vice Mayor if you have any further comments as well.
I think you covered a lot. I think I will repeat the statistic that I said at the beginning. The city of Santa Cruz is 23% of the population of the entire county, and we're providing 53% of the service areas. So in as much as we've, I think, progressed a lot on using managed camps as part of our solution, part of our model, as you can see, it's still not completely working. I do get a lot of emails from people who are wondering, about our open spaces, about our parks, about the places that their tax dollars, as they perceive it, are paying to be used, in certain ways. There's a lot of questions in neighborhoods. Most people understand the issue and they appreciate the managed camp, but they're not understanding the whole system in terms of moving people into a case management situation and then moving them into either temporary housing and then onto the permanent supportive housing. So again, we have bits and pieces of the model, but we don't have the full system built yet. And it's, in my opinion, it does weigh heavily on our city resources. You saw the amount of work that our city staff, and you heard from all of our staff that they've been doing up in the woods there and other places around the city. It's extremely expensive for the city to do this. We're spending hundreds of thousands of dollars. We just cut, $5 million from our budget last night. So it's not sustainable for a city of 62,000 people to do this level of care of homeless individuals in Santa Cruz County. It's not sustainable for us. And I really appreciate the county's efforts. I know everyone has worked really hard this past year. I think we've learned a lot. I'm very excited about your work with Focus Strategies to finish the model that we are all looking for. And I want to thank them. I want to ask our state and federal representatives to please think about what you've seen today. We need help contacting Caltrans. We can't have people sleeping on the right-of-way. We need someone in Caltrans to interact with the city so we can figure out a way to manage before a 4-year-old gets run over out on Highway 1 at 4 o'clock in the morning. So we need our federal representatives to think creatively with us, whether that's FEMA money. We need assistance with some of the criminal issues we've been discussed today. So if you could take the time, with you and your folks to think about ways that either point us into directions of assistance. If you ever need any of us to, meet with you again or describe our needs, please, let us know. We're here to tell you our story. We want to hear what you need more from us. We want to work collaboratively across state, federal, local government. And I think together we can start to make some progress. But we are in a dire situation. I'm going to be perfectly frank about it. This is not sustainable for the city of Santa Cruz to continue to do this much longer. I want to invite also Ryan COONERTY, our supervisor, who represents the city, to also talk and let us know, or to speak at the conclusion here today.
Sure. So, one, thank you to Justin and Donna for organizing the whole city team, and thank you to our state and local, state and federal partners for showing up. I think Donna's right that we need some frankness. The reality is the county has doubled the number of beds in the last 6 months, and the situation's never been worse. So there's no way for us to provide enough shelter and enough transitional shelter to address the series of issues we saw. It's just not going to happen. So in my 14 years of being in local government and dealing with this issue, we need to get on a population by population focused strategy. The folks up in Sycamore are different than the folks outside the fence, that are different from the folks inside the fence. We need a targeted strategy, pulling together all the different government agencies and work the problem and find solutions for these people and for the community on a almost person by person basis. As Donna says, we need better case management, better focus on diversion, and start to move forward, recognizing that we have these limitations. We're not gonna, they're simply, in a city of 62,000 people, we cannot provide enough shelter beds for people, and we certainly can't provide the transitional housing. We've increased it and increased it and increased it, but we're gonna have to, it's gonna take a more collaborative and focused effort going forward to address this issue, and we need everyone who's on this tour and more to commit to finding those solutions within that framework.
Can I say something real quick? I'm a resident of the camp, right? 62 years old, my name is Mike. Thank you, Adam. Yeah, right? This camp is helping me out a lot. 62. Alright? 2 going to America. Alright? I'm trying to get off the street. But the camp is doing it out for me, and I appreciate it. Yeah. All the people that donated and whatnot, I just want to say thank you. Because believe me, it is helping a lot. And thank y'all.
Thank you, Michael. That was lovely.
Yeah, thank you very much. Just to close out, just a couple of comments. I just want to remind you, in your packets are a summary of some of the kind of the major points that we'd like to kind of focus on your attention to. And I'll just give you those really quickly. And a lot of it has already been said. But from the city's perspective, clearly shelter and housing is important. And what we can do to significantly expand the short and long-term housing available to unsheltered people, we want to work on that. We want to do more of that to the extent that we can. Diversion and outreach, as board member COONERTY mentioned, how can we quickly implement a more robust diversion and outreach program is something that we really would like to work with you all to try to implement, so that we can have beds that are available on an ongoing basis. Because even though we've added a lot of beds, we don't have that availability that we need to problem solve on a day-to-day basis. Our police department, for example, tonight will not be able to address an encampment that happened in some city necessarily in a really quick way. And we need some of that, and then getting people, through to a better place. Risk and impact mitigation. You've seen the level of risk that we have with respect to our open spaces and our watershed. So how can we work to better manage that and to clean up encampments? And then finally, shared responsibility. How can we better approach the crisis as a whole county and at the statewide level, sharing the impacts and solutions? Again, we're here to support and to be a partner, and look forward to working with you to do that as quickly as possible. And again, thank you very much for your time today. Very much appreciated.
So if anyone wants to walk through Benchlands, you can come talk.